Thank you for joining us on the news desk yet again. The headlines. Zambia has recorded 3 new cases of COVID-19, bringing the total cumulative number of confirmed cases to 48. 120 police officers have been deployed to Kafue district to help enforce the lockdown aimed at facilitating the mass screening and targeted testing for COVID-19. And the Jesuit Center for Theological Reflection, JCTR, says there is need to put in place mechanisms that will protect and safeguard human dignity amidst the fight of COVID-19. Is the news in detail. Zambia has recorded 3 new cases of COVID-19 in the last 24 hours, bringing the cumulative number of confirmed cases to 48, with 2 deaths and 30 recoveries. Health Minister Chitalu Chilufya has told a daily briefing that of the 3 cases, 2 cases, both females aged 23 and 29, are contacts to the latest COVID-19 case from Makeni, while the 3rd case is a son of a diplomat who arrived in the country from Poland on the 12th of April aboard Ethiopian Airlines. Dr. Chilufya says this follows 150 tests conducted in the last 24 hours. He says the 3 new cases bring the total number of cases in isolation facilities to 16, 14 in Lusaka and 2 on the Copper Belt. Dr. Chilufya adds that all the 16 patients are stable, including the 74-year-old man who has since been taken off oxygen.
All the 3 will be in our isolation facilities under the care of our specialist teams. Countrymen and women, this brings the total number of confirmed cases to 48, including 2 deaths and 30 recoveries. There are now 14. There are now 14 cases in Lusaka and 2 cases on the Copper Belt. That means that under our care now we have 16 cases. All the 16 are stable, including our 74-year-old man who is now off oxygen support and is recuperating well. The total number of tests that we conducted in the last 24 hours was 150, and it is out of these 150 tests that 3 came out positive. We're still running some more tests. Cumulatively, we've now carried out 1,846 tests.
And Dr. Chilufya says the mass screening and targeted testing is underway in Kafue, aimed at ascertaining the extent of the pandemic in the transit town following the presidential authorization of the invocation of some provisions of the Public Health Act to restrict movement in the town. He says this is also aimed at early detection of cases and isolate the positive cases in order to disrupt the human-to-human transmission of the virus.
A team of rapid responders are on ground as we speak and have been mobilized from central, provincial and district level to enhance surveillance, to enhance active case finding and testing, and to ensure that all those who are found positive are isolated and taken to quarantine facilities. As we look at the cases that have been found to be positive in Kafue, we will ensure that they are quarantined in safe places where we're managing them. Their contacts, while awaiting results, will equally be quarantined in their homes. Our risk communication teams are active on ground and are engaging various stakeholders to effectively communicate to the public. Health promotion messages are being disseminated creatively, and we have various teams in various parts of the district carrying out this activity. We wish to thank the artists. We wish to thank Mr. Nguzu and BJ, the musicians that have come on board, those who have been creative to appeal to the fans, to the citizens, to adhere to the measures that have been pronounced. Let us ensure that we stay home and stay safe. let us mask up.
Meanwhile, the minister has warned private clinics against harboring cases of suspected COVID-19 or risk having their licenses revoked. Dr. Chilufya has also expressed government's appreciation to various stakeholders that have come on board to contribute towards the fight against COVID-19, such as the Jack Ma Foundation that has donated 18,900 test kits, personal protective equipment, among other things.
It's also important to emphasize that while everyone is at risk across all age bands, advanced age is a high risk. Immunocompromise, either because of HIV/AIDS and you're not on treatment, or many other conditions that can cause suppression of the immunity and you're not managing the condition, predisposes you to bad outcomes when you're infected with COVID. The prognosis, the outcome is poor with those features. So stay home. We partner with the private sector in so many different ways, including in the health sector. Private sector are our partners. We serve the same population, and as we talk about universal access to health services, we take into consideration those private facilities. There are people who afford to go there. That's access. So we are working closely with the private sector. However, I must sound a warning that private clinics should adhere to the guidelines in COVID and ensure that patients who are suspects are referred immediately and are not allowed to start managing those patients there, because they put at risk the other patients who are there and even the staff that are there. So private clinics that do not adhere to that risk closure.
120 police officers have been deployed to Kafue district to help enforce the lockdown aimed at ensuring mass COVID-19 screening and targeted testing. Police spokesperson Esther Katongo says the district has been zoned into 6 and officers have been deployed to all zones to ensure compliance to the lockdown by members of the public. Mrs. Katongo says some officers have been deployed at the Shimawala Toll Plaza, while others have been deployed at Kafue Bridge with the mandate of escorting convoys of motor vehicles through Kafue and ensuring that no motor vehicle picks or drops off people. Within Kafue district, she says police will remain on the ground until they are guided otherwise by relevant authorities. Mrs. Katongo states that all trading centers, including markets in the district, have been closed in an effort to restrict the movement of people.
The district has been zoned into 6 and police officers deployed to all the 6 zones to police the areas and ensure compliance by members of the public. Some police officers have been deployed at the Toll Plaza on the northern part of Kafue, while other officers are at Kafue Road Bridge on the southern part of Kafue, whose mandate is to escort convoys of motor vehicles through Kafue and ensure that no motor vehicle picks or drops off people within the district. All trading centers in the district, including markets, have been closed, therefore restricting movement of people. Our officers will remain on the ground until they are guided otherwise by relevant authorities.
The Jesuit Center for Theological Reflection, JCTR, says there's need to put in place mechanisms that will protect and safeguard human dignity amidst the fight against COVID-19. JCTR Deputy Director, Father Alex Muyebe, says the JCTR is therefore appealing to the government to utilize the Disaster Management and Mitigation Unit to ensure that vulnerable and poor households do not face starvation as government implements restrictions of citizens' movements and operations of some businesses to curb the spread of COVID-19. Mr. Muyebe notes that some of the measures have been or have resulted in reduction of economic activities and erosion of households' sources of income, causing untold suffering on poor and vulnerable households. He says the JCTR is of the view that the DMMU must already have in place a database of communities that need food relief in rural areas. Father Muyebe says the unit must also spread their identification of needy households even in urban areas due to reductions in income or loss of jobs in the wake of COVID-19. He states that while it is very important that the emphasis has been on curbing the spread of the virus, it is equally important that as a nation, there is need to ensure that the living conditions of vulnerable citizens do not deteriorate any further than was the case before the onset of this pandemic. Father Muyewe says the JCTR is urging government to mobilize resources to effect people-centered interventions such as expansion of social protection programs, especially the social cash transfer to reach poor households in both rural and urban areas to ensure continued nutrition even in the wake of COVID-19. Kafue Member of Parliament Miriam Chonya says Kafue residents should have been given at least 2 days before the lockdown of the town to facilitate the mass screening and targeted testing for COVID-19 following its classification as a hotspot. Ms. Chonya feels that this would have enabled every resident of Kafue to be aware of the lockdown. She says not everyone might be aware of the lockdown and might find themselves in conflict with the directive. Ms. Chonya has, however, welcomed the government's decision to lock down the district in order to conduct mass coronavirus testing following the 3 cases they recorded. She has since appealed to the Kafue residents to cooperate with the government officials to have been deployed to the district for mass testing and sensitization on COVID-19.
I personally welcome it because it's an effort which is meant to help us deal with the virus. It's fine since we are on red alert. We do understand that it's an emergency situation. But of course, there are some yesterday. So they were wishing that yesterday itself, they would have said on Wednesday, we are coming to do this and that, so that people would have prepared. So of course, there are some that are still wondering, in fact, whether this information has reached everyone, so they are not unaware and find themselves in conflict with the directive. I personally welcome it because it's an effort which is meant to help us deal with the virus. It's fine since we are on red alert. We do understand that it's an emergency situation. But of course, there are some yesterday. So they were wishing that yesterday itself, they would have said on Wednesday.
The Media Liaison Committee has threatened to withdraw its participation in the process of proposed statutory self-regulation of the media if the Independent Broadcasting Authority (IBA) does not reinstate Prime TV's broadcasting license forthwith. In a communique, the MLC, which is a grouping of 16 media bodies and organizations, has also demanded the withdrawal of police officers from Prime TV premises immediately, and the owners of the property and their staff be allowed unfettered access to their offices and business grounds. MLC Chairperson Enoch Ngoma says the MLC and its affiliate organizations are of the view that the cancellation of Prime TV's broadcasting license by the IBA has nothing to do with the coverage of COVID-19, but an attempt to deny Zambians an alternative platform of accessing information and debates on matters that affect them. Mr. Ngoma says the MLC is of the view that the cancellation of Prime TV's license is illegal, highly political, and totally against the digital migration policy of 2014. He says the MLC urged the government to take seriously the international statutes that the country signed on press freedom, access to information, and protection of the rights of citizens to free flow of information and ideas. The MLC is also demanding the dissolution of the current IBA board, the retirement of IBA Director General Josephine Mapoma in national interest, and the immediate constitution of an independent body to be the signal carrier for all television stations.
The Media Liaison Committee therefore makes the following observations. Number one, that the withdrawal of Prime Television's broadcasting license by the IBA has nothing to do with the coverage of COVID-19, an undertaking that the station, like any other media house in Zambia, has adequately and timely covered. Instead, we feel it is an attempt to deny Zambians an alternative platform of accessing information and debates on matters that affect them. Number two, the cancellation of Prime TV's license is illegal, highly political, and totally against the digital migration policy of 2014. The Media Liaison Committee is aware that the Independent Broadcasting Authority did not engage Prime TV before cancellation of their broadcasting license, as stipulated under the IBA Act and under normal rules of natural justice. We are also aware that the IBA board did not deliberate on these matters. It It was an impulsive and illegal decision.
Trade Kings Foundation has made a contribution of 28 million kwacha to the Ministry of Health for the campaign against the spread of the coronavirus pandemic. Presented the check to the Minister of Health, Trade Kings Group General Manager Lux Subramaniam said the 28 million kwacha will cover three aspects, which include medical supplies, prevention and awareness dissemination of messages around the COVID-19. And Mr. Subramaniam has explained that the area of prevention will cover employees, bus terminals, markets, prisons, shopping malls, hospitals and COVID-19 quarantine centers. He adds that the assorted medicines and medical equipment, which will include ventilators, personal protective equipment, as well as close to 500 oxygen cylinders, will be covered in the area of medical supplies, while multilingual programs and advertisements will be paid for on various media platforms, and these fall in the area of awareness.
The directors of Trade Kings Foundation have decided to contribute 28 million kwacha, I repeat, 28 million kwacha towards this endeavor, and will strongly support the Ministry of Health until such time this calamity drifts into obscurity. This integrated approach to the campaign and working hand in hand with the Zambian people gives the foundation confidence so that the spread is prevented, contained and managed. Honorable Minister, I want to echo back as I conclude that as Trade Kings Group, our passion is beyond merely providing innovative products to our customers. Instead, we envision through the foundation to be an ardent partner in corporate social responsibility frontier with the government and the people of Zambia. This would imply playing an active role of plowing back into communities and uplifting lives of the Zambian population. May I say, Honorable, your leadership has been unrivaled, and on behalf of the Trade King Board of Directors, shareholders and the Trade King Foundation Directors, we are grateful for your support.
And upon receiving the donation, Dr. Chilufya says government cannot manage to achieve health financing without the help of cooperating partners, especially now in the wake of the COVID-19 outbreak. The Health Minister is confident that the donation by Trade Kings will go a long way in helping the fight against COVID-19 pandemic, calling on other corporate entities to emulate the gesture by Trade Kings.
The Treasury, the innovative measures we've put in may not speak to the whole resource basket that we need for universal coverage. It therefore summons us to the imperative of forging partnerships with the corporate world to ensure that we leverage resources to provide health for all. The corporate world that promotes the common aspirations of our people, that is to be healthy and productive, will be our allies. Today we gather to celebrate one such ally. Trade Kings Foundation has been a strategic partner of the government of His Excellency President Edgar Chagulungu in its aspiration for universal coverage. Health for all entails that we strengthen health systems, integral to which is resilient health security. At a time such as we live in today, in the face of adversity, in the face of the COVID-19 outbreak, we require to hold hands with friends. We require to raise resources.
Also has deployed council police officers in cemeteries across the city to control overcrowding during burials. Council Public Relations Manager George Chimba says the council has noted with concern that mourners are turning up for burials in large numbers, contrary to the public health guidelines on public gatherings in the wake of COVID-19 pandemic. Mr. Chimba has stressed that the guidelines on public gatherings, including funerals, that the number of attendees should not exceed 50 in order to leave enough space for observance of social distancing, especially that there could be more than one family conducting burials in the same vicinity. He says guidelines on funeral gatherings do not only apply to gatherings at funeral houses, but also at the mortuary and burial, where only a few critical people should be at the mortuary to collect the body, while others should go and wait at the cemetery with a total number not exceeding 50. Mr. Suchimba adds that the council has also engaged the bereaved family representatives from the death certificate office at 2TH on the need to adhere to the directives in order to curb the spread of the coronavirus. He has since appealed to members of the public not to take the action by the council as punitive on the part of the bereaved families, but a measure aimed at protecting the lives of people from contracting the spreading of the coronavirus.
The police officers have been deployed so that they can control the overcrowding that is happening in there, arising from the fact that public gatherings of more than 50 people have been banned, including funerals, that is at a funeral house as well as at the burial site. But we have learned with concern that some monarchs are going in numbers, thereby overcrowding, especially that there are others from other families that are also burying. So this is a concern to us as Lusaka City Council. We have been sending messages to bereaved families, but it's like people are not following the guidelines. And so we have decided that we deploy council police officers that will help in controlling the crowds in all our cemeteries. But we want to take this opportunity to remind those that are bereaved that only critical people should be allowed to go to the mortuary as well as the burial site, so that we can avoid overcrowding and observe social distancing. This is not a punitive measure, but we know what is happening in the country and the world at large, that we are affected with the coronavirus pandemic, and so we need to take precautions.
Partnership for Regulation Economic and Policy Statistics Program Coordinator Ndonga Kamelu has expressed President Edgar Lungu for the intervention and policy directives put in place to help small medium enterprises during the COVID-19 pandemic. Mr. Ndonga says the 10 million kwacha is a 10 billion kwacha credit facility to commercial banks by the Bank of Zambia for onward lending will benefit the SMEs. He has since called on all commercial banks to adhere to the policy directive in relation to the credit line. Mr. Ndonga has advised SMEs to engage in cost-cutting measures and maximize on profit-making during this period.
I think there has been a very balanced approach in the lockdown measures and in some of the interventions that the government has put in place. For instance, the 10 billion line of credit that has been given out so that commercial banks are able to lend SMEs at a reduced rate. I think that's very commendable, and we just urge all the commercial banks to adhere to this policy directive. But also, the onus is on the SMEs themselves to be able to, in a period like this, ensure that as much as possible they engage in cost-cutting measures that will see them reduce their costs and maximize on how much they can make in a period like this. While it is good that there's a line of credit at a reduced rate, we do not know how long-standing the effects of this COVID-19 are going to be. Therefore, it's very important that even in contracting some of these credit, the process should be done in a very prudent manner, so that in the long run it benefits the SMEs and not come to haunt them in the future.
67 Angolan citizens who were stranded at Chavuma District Hospital in Northwestern Province since March 20th, 2020 have been repatriated to their country. Chavuma District Administrative Officer Kenny Mundengende says the Angolan nationals were repatriated to their country during the Easter weekend. Mr. Mundengende told Zanis in Chavuma that the affected Angolans were earlier not allowed to enter their country, as authorities in that country closed Kalipande Chingi border on March 20th, 2020 to contain the spread of COVID-19. He says the Angolan nationals were seen off by a combined team of security personnel from the Zambia Police Service and Special Division under the Office of the President. Mr. Mdengende adds that the Angolan authority nationals commended the Zambian government for facilitating their way back to their country and providing logistical support during their stay in Zambia. Most Angolans from the nearby province of Moxico depend on Zambia for their food and medical attention from the nearby Chavuma and Chitokoloki mission hospitals of Chavuma and Zambezi districts, respectively. The Patriotic Front in Lusaka District Chairperson Forbes Mfwaya has reminded all party members in the district on the need to unite and complement President Edgar Lungu's efforts in the fighting of the COVID-19 pandemic. Mr. Mfwaya says party members in the district should put aside their differences and unite to combat the further spread of the coronavirus pandemic, as well as help in spreading the campaigns around the pandemic to the communities. He notes that President Lungu and Health Minister Chitaluchi Lufia have shown political will in fighting the pandemic. Hence the need for all structures in the district to follow suit by reaching out to the communities on the importance of adhering to the measures that have been put in place to prevent the spread of COVID-19. Mr. Mfwaya has since pledged his commitment to working closely with all party structures in the district to help fight COVID-19.
We are all aware that it's a deadly disease and has been seen by the efforts that the Minister of Health, through its Minister, Honorable Chitaluchi Lufia, is doing. It's very, very commendable. And I appeal to all Zambians to adhere to the guidelines that the Minister of Health keeps, giving us through the daily updates that we are receiving. And it's important for all of us to, adhere to those guidelines to keep ourselves safe and our families safe. And at the same time, I would like to appeal to my colleagues in the Patriotic Front, especially Lusaka District, to remain united as a party and continue helping the President in his efforts to develop this country, and especially during this time, which is very, very, scary. At the same time, I want to warn those masquerading as PF members who are going around, making statements. Some of the statements are insulting in nature, directed at party leadership and government leadership, to refrain from doing so. Because as a party, we've got the guidelines, we've got our structures, and if anybody is grieved or they've got concerns that they need to raise, there are channels that are laid down which have to be followed. And I appeal to them, especially at this time, to behave themselves and ensure that the party remains as united as it is.
Works under the Pave Zambia 2000 project have resumed in various townships of Bwanamkubwa constituency in Ndola, having stalled for more than 2 years. Area Member of Parliament Jonas Chanda has disclosed that works under the project have resumed in Mushili, Ndeke, Mackenzie and Itawa townships. Dr. Chanda says the project had stalled in the constituency from 2017 due to lack of funding. He says the resumption of works under the Pave Zambia project comes after he lobbied the government to pay local contractors working on the project in the constituency. Dr. Chanda is hopeful that works will be completed before the end of the year.
What we're doing here, this is the Pave Zambia road project. This is Mushiri, Porokoso Road and Lunga Road. As you can see, this project had stalled for 2 years, from 2017 up to now. Over 2 years, actually almost 3 years, and the residents had complained. So what I did as a Member of Parliament is to engage the National Road Fund Agency, the Minister of Infrastructure, and the Minister of Finance for the contractor Frog to be paid. And we have another contractor, Virgin Contractors in Ndeke, Mackenzie and Itawa. So right now I'm happy to say the contract, Pave Zambia, the road contract has started. As you can see, a lot of pavers that have been brought by the contractor. We estimate that this project should be done very soon, so that these gravel roads in Mushiri, in Ndeke, in Mackenzie, in Itawa cannot be completed under Pave Zambia Road project. And I want to thank His Excellency President Edgar Lungu, because when the coronavirus happened, the President ordered that all local road contractors should be given 140 million kwacha, which the Minister of Finance has released under the direction of His Excellency the President. And that is why you see our contractors now restarting the work. It's because of that intervention, so that people are not jobless, but also residents benefit. Good roads bring development.
That item brings us to the end of the news at this hour. But before we go, here's a recap of stories in the headlines. Zambia has recorded 3 new cases of COVID-19, bringing the total cumulative number of confirmed cases to 48. 120 police officers have been deployed to Kafue district to help enforce the lockdown aimed at facilitating the mass screening and targeted testing for COVID-19. The Jesuit Center for Theological Reflection, JCTR, says there's need to put in place mechanisms that will protect and safeguard human dignity amidst the fight against COVID-19. That's the news. Thank you so much. Bye-bye. Remember to stay safe and sanitize your hands.